Hi everyone. The voice may be familiar, but it's the face we're going to have to deal with today because I too am a patient of Dr. Truong's. And we'll go into more about what I had done just a little bit later. With your patience, please. Now today you're going to be learning about all of the different aspects of plastic surgery and anti-aging. Some of you have probably thought about this a long time. Some of you may be rather new to it because there's so much exposure in the media now about looking better. We'll get into this as this little seminar proceeds. Now, are you worried about pain? So many of you, when we do these seminars, are worried about pain. Ooh, it's gonna hurt. First off, many of the procedures that Dr. Truong does are non-invasive, non-surgical. They're not cut in India. It's done with lasers or injections, and all of it is extremely painless. But even the surgeries that you may encounter with Dr. Truong, the healing is quick, there's virtually no pain, and you're going to love the results. Now, we're going to sort of begin with the ending here. Treatment after the surgery, or maybe leading up to the surgery. I want you to meet Rena Simone, who is Dr. Truong's medical esthetician. Here she is.
I'm Dr. Truong's esthetician, and I am the person you see for skincare. I'm the one who enhances before you go in and even enhances more after you go in to see Dr. Truong. I have over 30 years experience in this skincare field. I've worked with dermatologists and other plastic surgeons as well for the last 14 years. And I have some training from New York City and some training from Beverly Hills in the last 30 years. And I am there to help you feel good about your skin, and you can see an immediate change in just one chemical peel. In 20 minutes, you can have smoother, softer, cleaner skin. We carry the products La Roche-Posay, which is strictly sold in a plastic surgeon's office, and also Biomedic. They have active ingredients of different acids and enzymes. We also use different chemicals like glycolic, salicylic, lactic, resorcinol, TCA, trichloric acid, numerous different peels, and numerous different acids. So depending on the skin and the type of problems you're having with it, discoloration, acne, large pores, oily, dry, whatever the case may be, would depend on the different chemical that we use. We do extractions, of course, clean out your pores. And of course we do some makeup. Now, in the makeup department, if you go in and have your eyes done or your face lifted or neck, whatever area, if you need to get out sooner than you thought, then we can speed up the process by doing some corrective makeup. The lymph drainage massage is a very valuable tool to speed up the healing process. And if you need help in the skincare department, I'd be the gal. Thank you.
Well, let me start with this one. I love doing this. You know who this is? Brigitte Bardot. At one time, the most beautiful woman in the world. Now, unlike most big stars, Brigitte has said no to enhancement, taking care of her skin. She loves to be in the sun, plastic surgery. She just wants to look like a natural woman, which is fine if you so desire to make that choice. So let's see what the natural woman looks like now. Now, if you're content with that, that's fine. That's fine. But this is a very good example of somebody who is really tremendous looking in their youth, who really lost it in their older years, which happens to all of us. But she has so many particular things that she could easily do now that would bring her face back to life. Okay, and that's one of the best examples in the world, because everybody, you know, my age and up remembers her. Okay, on the left is the former criminal, Ray Appleton. Notice how this surgery changed the color of my beard, too. It was remarkable, you know. Just happened overnight. I woke up from my little quick hospital stay. Now, let's look at this. I had 7 hours of surgery. As you can see, it's very subtle. I had the whole Megillah. I had a neck lift, where this down here was making me nuts. That was the prime reason. I couldn't stand it. You know, I had no profile anymore. I just went, you know, and so I had a neck lift. I had a lower face lift, so I could get rid of the chipmunk cheeks that I've had all my life and the jowliness that I was beginning to get. Now, this is me yesterday, but I'm going to show you something. This is me before I had my smile lift. Now, you see what my mouth is doing? It's pointing down, isn't it? It's kind of like sad. You can't see them in me because I hide them. They're called puppet lines, marionette lines. You have lines here. You've lost the texture of the skin, the muscle control, and your mouth droops, and you look like an old grump. Now, you probably really can't tell a lot of difference now because it's very subtle. If you were to come up here and stare at me, you'd figure it out in a hurry. Some people noticed it right away today in the office. They're like, what'd you do now? I mean, they could see right away that I had, something was very subtly changed. And as you can see, I looked like some kind of a bad actor before with that scowl and my mouth and all that, and that just wasn't me. Everything that I had done, with the exception of the smile, was surgical. Now, let's be real honest. When I got home and sobered up after all of the IV stuff and looked in the mirror, I looked like a DC-10 had hit my face and caught on fire. All right? It's not pretty. But the rate of healing is unbelievably fast. Dr. Truong says you need a brow lift. And I said, I don't need a brow lift. That wasn't in the cards for me. Can you see the difference? I've gone from, a werewolf to looking like a normal person. This is major surgery when you do this stuff. But it's perfected major surgery, so there's really not a lot to worry about. Okay? All right. Now, somebody who knows a heck of a lot more than me. All right, and we'll make this very quick for you all tonight because I know you hate long seminars. This is Dr. Peter Truong, and he is the master, okay?
I started my medical career in ophthalmology. I'm a board-certified ophthalmologist. But while I was in training for ophthalmology, I realized that there's a whole world in ophthalmology where we just do cosmetic surgery and plastic surgery around the eyes and on the face. And that's called a fellowship training. So I went to do a fellowship at Indiana University, and for 2 years, that's all I did. And so I specialize on the face. I don't do anything else. Look, when you see an attractive face like this woman here, most of us, pretty much all of us, have a positive response. It's very natural to have a positive response to someone who's attractive. There's studies that shows even as babies, you show them pictures of people that you and I would consider attractive, and you can measure a positive response. They will smile. They will maintain good eye contact. You show someone who's ugly or someone who you and I would consider, man, he's not a good-looking person, and as babies, they would have a negative response. So having an attractive face is a big advantage in life. Will you do some things to improve the way you look and to maintain it and look the best you can at all stages in your life? The picture on the left, that's Chris. She works for me now. She was a patient, and that was several years ago. And the picture on the right is how she is now.
Hi, my name's Chris, and I found Dr. Truong through a referral from an optometrist. I'd gone in for my annual exam, and the optometrist actually asked me if I was perhaps having any visual impairment due to the sagging of my eyelids. Well, I had realized that my eyelids were sagging over the years. I was having a lot of trouble getting my makeup on the way I used to be able to put it on. I used to have actually, my eyes were probably my best feature. And I realized that they just didn't have that clarity and spark anymore.
The only surgery that we've done for her here is her upper lids. Everything else was done with injections, with lasers and things that don't require any recovery.
So when I went in for the surgery, I went in on a Monday, had the surgery. That afternoon, little discomfort, not too bad. The next morning, I wasn't even taking any pain pills. The surgery was so easy. I kind of had made a bigger deal out of it in my head than it really turned out to be. I am really, really pleased with the way my eyes look now. He gave me back the eyes that I had when I was much younger. You know, we're living longer these days, so we've got to hold on to what we have a little bit longer.
And you can see that she looks better now and looks younger now than she did several years ago. This is the outline of what we're going to talk about tonight. We're going to talk about skin. We're going to go on to talk about facial cosmetic surgery. And we'll give you some pointers on how you should pick a cosmetic surgeon. When you look at this face here, basically you see three main things. You see skin changes. Obviously, there's a lot more wrinkles on the face. You can see sagging, especially down in the neck here, where things starts to hang down. And the third thing you see is called deflation. Deflation is basically shrinkage. We lose baby fat as we age. So the face starts out being nice and oval, and then it can shrink in, and you can start to see depressions developed in the cheek area. The eyes sink deeply in the socket, and you can see shrinkage around the mouth as well. So in order to deal with all of these three aspects of aging, we develop different ways to do that. You can't just take care of wrinkles without, and you can't just take care of sagging. You have to look at all three aspects in order to do a good job. When you look at someone who's young like this, their skin is wonderful, and you can see it. There's no lines, the skin is firm, it's soft, it has nice elasticity. And as we get older, we can see wrinkles, we can see age spots, different type of pigmentation problems. We can see sallow skin tone. What that means is it looks like the skin doesn't have really good, nice blood supply. And one of the things that we can do, which improves the texture of the skin very quickly, is laser skin resurfacing with a CO2 laser. This basically removes wrinkles on the face, and it also tightens the face, removes pigmentation. This is a process that will have downtime, however. The way that this works is the laser removes the top surface of the skin where a lot of the fine wrinkles are, and then the skin will heal over in about 10 days. This is done under anesthesia. This is a patient that had laser skin resurfacing, and this picture is taken about a month after laser skin resurfacing. And as you can see, a lot of the wrinkles are gone. The spot here is gone. A lot of patients will ask me, well, you know, do I remove all the wrinkles with this process? And the answer is no. You get about a 50% improvement, sometimes more. There are two kinds of wrinkles. There's static wrinkles and dynamic wrinkles. Static wrinkles are not caused by muscular action, where dynamic wrinkles, for example, the crow's feet or the wrinkles around the mouth, are caused by muscular action. And those don't respond as well to laser skin resurfacing. They respond better to Botox. Same patient, and if you look at this wrinkle here, you can see how it goes from the neck all the way to the ear, and the same wrinkle stops here at the jawline. And obviously, we have done resurfacing on the face, and we stopped at the jawline. The resurfaced skin is a little pinker than normal skin, and that pinkness lasts anywhere from 2 to 3 months after surgery. It is surgery. It's laser surgery. Now, laser skin resurfacing will also do tightening, and that is a little hard to predict, so I don't really promise that, but I can show you that right here. You see how the lower lid skin is a little bit loose right there, and over here you see how it's a lot tighter. So we'll do that, and we can see it right when I do the laser resurfacing. Some more examples of patient that had laser skin resurfacing, and basically it removes wrinkles, as you can see. We can do CO2 resurfacing on patients of color as well. Obviously she's a Latina, and this picture again is taken about a month later. Now take a look at this. See, these two photos are taken on the same day. Okay, remember what I said about laser skin being a little pinker? That skin is not only pinker, but it's a little shiny, and it's real thin because it's freshly healed skin. And that's normal. With the right makeup, you can look fairly normal and function fairly normally. Again, this goes away after 2 to 3 months. Okay, during that time, it's very important not to be exposed to the sun. That's the makeup that we use in the office to cover makeup, and it comes in different shades. This makeup actually promotes healing, so it's wonderful. A lot of our patients buy some of this makeup for their different injections that they come in on a regular basis.